Well, the first question I always ask individuals or families uh, what they mean by in unpacking that is one of the first things is have you asked the child? And it sounds kind of like just a matter of fact kind of question, but it's amazing how many people are like, oh, well, I just want what's best for my kid. I just want what's best for my kid, but they've not included their kid or their teen or their child, their loved one in that process, whatever. And now, granted, with some emotionally and mentally dysregulated and disabled children, that concept may be an anathema to actually what is in their best interest, and that sometimes is the pathology of the mental illness or the problem that they're facing. But nonetheless, it is important to just ask that question. And I can't tell you how many conversations and how many family dynamics have been shifted drastically just by including that question into the dynamic of, well, have you asked your child? That beyond that, the other components that step in are immediate safety. So, if you have a child or a loved one or someone that you're a family member that you're working with or trying to get help for, if that person is suicidal, if they're homicidal, if there's a history or a high probability of them being violent or engaging in harm against themselves or somebody else, then the overarching and primary interest is always safety and keeping that individual alive and keeping the individuals around them safe from harm. So I would say that is always paramount, is patient client safety is always first. And then beyond that, it goes into a discussion of really goals, and what that individual or the family's overall life goals are for their child, what their educational goals are for their child, what their professional goals are, what their developmental goals are. Then it just becomes a series of questions and conversations that the families, and again, including the patient in these conversations, need to have with one another about, like, okay, what is in the best interest? And sometimes we have to forego and suspend for a little bit our expectations or the family's expectations.